Hey, subluxation-based chiropractors, Dr. Fred DiDomenico again with Elite Coaching and Chiropractic United, coming back to you to tell you I have more fun and exciting things coming up. Notice I'm here in part of my home in front of this cool fireplace, even though it's the middle of summer and I'm sweating from the heat coming off here. But the whole theme here is because from the comfort of your own home, you can see a webinar on July 13th at 6 p.m. Pacific time. And Dee Harrison, a CVP, and myself are going to give a webinar on the Dennerolls. Those are actually spinal orthotics. What's that mean? They're actually orthotics that you have patients lay on that actually have been proven in research to restore the normal curves. What's the nemesis of chiropractic? First of all, it's that cervical curve. And the cervical curve is dependent on the thoracic curve. There's the Dennerolls are orthotics for each area of the spine that can actually mold those lordotic kyphotic curves. They can correct a cervical kyphosis, and guess what? It doesn't matter what technique you do. You can do diversified, Gonstead, activator, yet have a patient lay on these Dennerolls and show a pre and post x-ray change. Isn't that what chiropractic was about? Isn't that what subluxation based is about? It's based on the philosophy that a subluxation and an abnormal curve causes disease. And as chiropractors, do we have the responsibility to show a person, hey, here's a normal spine, here that represents health, here's your messed up spine, that represents disease, and maybe we should take them from that messed up spine back to that normal spine and restore their health. Hey, we've been at this game in this profession for a lot of years, what, 112 or so years, and now we have something finally in the profession that any chiropractor can predict a predictable correction. So you can see the indications, what types of curves you use these on, contraindications. And then I'm going to show you Elite Coaching. Elite Coaching is a management system specific for spinal rehabilitation and correction, of how to use that in a stress test on day 2, how to lay a person on there, position this thing, take a post x-ray, and show a predictable change. Hey, part of the reason some of your patients are walking out the door, in spite of whether or not you can help them, is because they don't know what they're buying. The principle of chiropractic sometimes isn't tangible. They may think it's a belief system, but when you can lay a person on a Denneroll, have them lay on there, stand up and put them in front of an x-ray and show a change, or x-ray them on the Denneroll and show a change, then these orthotics, the Dennerolls, will make that change on post x-ray in 90 days, one variable, if they do it. So here's a home care system, no matter what technique you can use, can literally elevate your clinical results, really be true with the principle of chiropractic and what a subluxation-based chiropractor can really do. So I think it's your responsibility. Be on this webinar. Again, it's July 13th, Wednesday night, 6 p.m. Pacific time. You'll have the link next to this video, and send us your email. You can send it to drfred1, drfred1 at msn.com. You can call me at 253-851-8353, or call, you can get a hold of Dee Harrison at drdeed at idealspine.com for any questions. All right, gang, see you there. Wednesday night, 6 p.m. You'll get all the information, July 13th. That's Pacific time. Have an awesome day. We'll talk to you soon.
I don't know what I've been living on, but it's not enough.